Hello, U9, and welcome to the last lesson of week 9. It's going to be quite a heavy topic, I am afraid. It is something that is in the specification. It is important that we need to know about and understand the science behind it. But I know that for some people, it might be quite close to home. So if you feel at any point during this lesson that you need to leave this video, then that's absolutely fine and understandable, because we're going to be looking today at a non-communicable disease, which is cancer. Okay. So what I would like us to do before we get going on cancer, the different types and risk factors in it and things like that, I'd like you to come up with 3 keywords from last lesson and come up with a definition. So I think that last lesson was Miss Corbett's one, if I remember rightly, and it was looking at kind of risk factors and data on non-communicable diseases. So 3 keywords from that with a definition. 3 key points in summary sentences, or a paragraph summarising all of that. So I know that things that come up in that lesson will be causation, correlation, obviously non-communicable, so you can talk about any of those. So if you pause the video now, have a go at that task, and then if you go back in your notes, check that you had all that information and it's correct, and then we will move on. Okay, so we're going to be looking at, say, cancer today, and we're going to define what a tumour is, which is a mass of abnormally growing cells. We're going to state some causes of cancer and think about some benefits and risks of chemotherapy. For level 5 to 6, we're going to describe the difference between benign and malignant tumours, and describe why carcinogens and ionising radiation increase risk. And then for 7 to 8, we're going to explain how benign and malignant tumours can be life-threatening, and link a lack of control in the cell cycle to tumour formation, and then evaluating risks of chemotherapy. Okay, now you might recognise some of these words, like mitosis, from one of the first few weeks of the lockdown. We did the cell cycle. And these are the stages of it. We did it as 3 stages, which you need to know for the specification, but you can break it down into 4. So we have the growth of the cell, the synthesis of the genetic information, so that's where it's doubling, preparing for that division for mitosis, and then the process of mitosis. So how does this cell cycle that we've done before, how does it link to cancer? What is the link between those things? Does anyone know how they go together? Have a think. Okay, so well done if you knew what it was. But actually that cell cycle, the lack of control on the cell cycle, is what causes cancer. So cancer isn't a pathogen or a microorganism that gets into you. It's actually your own cells that keep dividing, and they have no control. And you create these growths or these tumours. So cancer is a disease that affects people in many families. I think most people have family members who have been affected by it. The cells in your body divide regularly. That's the cell cycle, so that is important. That needs to happen to make sure that we're fixing and replacing cells. A tumour forms when control of this cell cycle is lost, and the cells grow in an abnormal and uncontrolled way. So what we're going to do now is you're going to exit this video. Then you're going to go to show my homework, and you're going to click on the link that goes through the process and the control or the development of cancers. So you're going to watch the video clip, and you're going to write a sentence to explain the link between errors in the cell cycle and cancer. So having that link between mitosis, that normal cell cycle, what happens when it goes wrong, and cancer. Okay, so leave this video now, clicking on that link, and pop a sentence or two down about that link. Okay, so hopefully we've got the link between it. Look at the errors in the genetic information that is causing the cell to continuously divide, causing these tumours. So tumour cells do not respond to the normal mechanism that control the cell cycle. So normally cells will have kind of instructions of when to divide, how often to divide, and things like that. They divide rapidly with very little non-dividing time for growth in between each division. So they're just constantly dividing. Okay, so you can see on this picture what can happen. We've got the normal cells and then this kind of balloon of cells that is forming, and that will be the tumour. This results in a mass of abnormally growing cells, which we call a tumour, which is said. Some tumours are caused by communicable diseases. So there are actually a couple of cancers that can be triggered by pathogens. Quite a one that you'll be familiar with is cervical cancer. Cervical cancer can be caused by the HPV virus, or the human papilloma virus. Which is why there is now a vaccination program where girls are vaccinated against HPV. Even though girls and boys can both get HPV, we see there isn't the risk of cervical cancer. Now, there are actually two types of tumour, and they are very, very different. So often we'll use cancer as a broad term. But if we're actually looking at these tumours, there's two different types, and we need to know the names of these two different types and how they are different. So the two different types are put in bold. We have benign tumours and malignant tumours. Okay, so both of them are caused by this abnormality in the division of the cells, but they can be split into two. We're going to look at the differences between the two in a minute. So can you put down the two types of tumour? Now, as you're doing that, both of them can cause health problems, but one of them is significantly worse than the other in terms of mortality rate. So we're now going to move on and we're going to be looking at the two types of tumour. Now, I do not want you to write down what's going to be on the slides because there's going to be a lot of information. So you can listen to me, you can then read through the information, and you can summarise each tumour in a couple of sentences. Start with benign tumours. Now, a benign tumour is it's a tumour, so it'll feel like a lump, but it's not a cancerous tumour. So even though it might be referred to as cancer, it's just a lump. And unlike what is actually cancerous tumours, which is the other type of tumour that we'll look at in a minute, it doesn't spread throughout the body. So you have a lump in a specific place, and that will grow, but it doesn't break off and form tumours around your body. It stays in one place. Now, even though it's not spreading around the body, that one lump, depending on where it is, can cause issues. A lot of benign tumours are actually cause no problems. They can be removed, they can be left there if it's not causing any issues, and they tend to be less serious. But depends on where that tumour is, because if it is pressing up against a really important nerve, or if it's pressing up against one of the arteries, or even on your brain, then that can cause obviously issues in itself, and they would tend to be removed. Now, the benign tumours are often surrounded by a protective sac, which is actually created by your immune system. So your immune system actually creates a sac around the tumour to try and keep it contained. That makes it a lot easier to remove if you do have an operation. Now, you might have come across some of these terms before. These are the most common types of benign tumours. Adenoma, that tends to be in sort of the skin tissues that cover your organs and your glands. We're going through the list. Other ones that might be familiar is the papillomas. So this can cause benign tumours in the skin, in breast tissue, in the cervix. So that's the cervical one. We've also got lipomas, that's in the fat cells. Something that many of you will have is the nevi, or the nevi, which are moles. So quite a few different types of benign tumours. And as I say, the vast majority don't cause any issues. It just depends on where it's growing and how much it's growing. Some suspected causes of benign tumours can be anything from a traumatic injury. So if you have a large impact on a part of your body or something like that, that can trigger it. Chronic inflammation, or if you have long-term stress problems, because that leads to inflammation. Infections and diet are thought to be common triggers of benign tumours. But it's quite hard to study and get the information for. So these are just suspected causes. So if you want to pause the video now, you can have a read through of the information, and then if we just get a couple of sentences that summarise a benign tumour, what it is, problem that can be associated with it, and what maybe a suggestion of what could cause it. Okay, so we're going to move on now to the nastier of the tumours, and that is a malignant tumour. And malignant tumour means the mass is cancer. So this type of tumour is what we're really referring to when we're talking about cancers. The word malignant is actually from Latin. Quite a lot of scientific words are from Latin. That means badly born. This type of tumour has the ability to multiply uncontrollably, so similar to the benign one at this point. And then also it's able to spread to different areas around the body. Now that's important because that is what is really dangerous. Quite often, if you're diagnosed with something like breast cancer, you could actually then succumb to cancers that are forming in the lungs. But because it originated in the breast, it would be referred to as breast cancer. Malignant tumours are formed from abnormal cells that are highly unstable and travel around in your bloodstream. So little bits of it kind of break off and go around your bloodstream, find somewhere else, and then start creating another tumour. Common types that you might have heard of are sarcomas, and that tends to be in connective tissues, and carcinomas, which are in organs and glands and places like that. Now, initially, you might not have any symptoms if you have a malignant tumour, because it will just be a small tumour on its own that might not be interfering anything that's particularly important. These types of tumours are elastic, so they're actually able to grow quite big before they're detected. As they grow and start pressing against important parts, that's when you start getting symptoms, and then metastasize, and that's where it's moving around the body. So can you pause the video now? Can we summarise what a malignant tumour is, please, in a few sentences? You will also see that there is a link to a video that I would like you to watch after that. I will name it Malignant Tumour in the on Show My Homework, so that you're able to see this process actually happening. Okay, so get your definition for malignant tumour, then exit this, watch the video, and then come back again. Okay, welcome back. So we're now going to do a couple of questions just to see whether you're understanding what it is that I've been talking about for the past 15 minutes. So we've got 3 questions here. For the first question is, what is a tumour? And that is going to be worth 3 marks, so you do need to get 3 things in that. Second question, describe the difference between a benign tumour and a malignant tumour. Again, 3 marks, so we might need to have a think about things outside the obvious. And then C, suggest ways in which both types of tumour can cause serious health problems. And that is actually going to be worth 4 marks. So you're going to want to think about 4 ways in which these tumours can cause an issue. So it should take you about 10 minutes. So pause the video now and have a go at answering these questions in full sentences. Okay, so we're going to go over the answers now. Grab a different colour pen, see how we got on. So the first question was, what is a tumour? So if we've said that it is a mass of abnormally growing cells, that is a mark. Formed when the normal control of the cell cycle is lost, or words to that effect, would be a mark. And then about the cells dividing rapidly would be a third mark. The next question was, describe the difference between a benign and malignant tumour. So a benign tumour grows in one place, or you could have said malignant can move around the body, grows in several places. You could have said that a benign tumour is usually in a sac, and that it doesn't invade other tissues. Any of those would be marks. A malignant tumour invades neighbouring healthy tissues, so it moves around. You can say that it moves, bits of it break off, or clumps of cells break off and go around the body in the blood. That also would be a mark. And it was worth, let me have a look back, worth 3 marks. So you need to get 3 of those things. And the last question was, suggest ways in which both types of tumour can cause serious health problems. So you could have said about the size of them. So if they grow large, that would be a mark. If you said that it could then press against organs, such as the brain, anything like that, could be a mark. Or you might say it might press against arteries or nerves. That could be a mark. Malignant tumour might break into pieces. That would be a mark. And taken around the body, perhaps you said in the blood, that would be a mark. And then that would make new tumours. That would be a mark. And that they can disrupt tissues and organs and things like that. That would also be a mark. And that was worth 4 marks. So hopefully we got 4 points in that. Okay, so we're now going to look at 6 different types of cancers. For each one of the cancers, you're going to need to put down the name of the cancer. You're going to put a couple, at least 2 risk factors for the type of cancer and the area of the body that it affects. Okay, so what you might want to do is create a table with these 3 things in the columns, and then room for 6 different cancers, and you can put the names of them in the first column. Or you can do it just as a list, but you might want to write down somewhere, either in the table or in your notes, the 3 things that we need to know about each one of them. So the name, the risk factors, and where it affects, because that won't be on each slide. Now, there's going to be a lot of information on the slides, but you just need to pick out those 3 things. So after each one, you might want to pause it, read through the information, because I won't refer to all of it. Read through the information and make sure you have those 3 things answered. So here we go. We're going to start off with quite a common cancer, and that is lung cancer. Okay. Now, there's 2 main types of lung cancer. You've got small cell lung cancer and non-small cell lung cancer, and they are slightly different to each other. You can read through how the difference between those two. You don't need to know it for the specification, but if it is something that you are interested in, then at the end of this, obviously, when I ask you to pause, then you can read through that. Now, you definitely would have heard of ways in which you can reduce your risk of getting lung cancer, so not smoking or not being in close contact with people that are smoking. So there's now laws about smoking with children in the car because you're in a confined space, things like that. Your diet can actually be a risk factor in lung cancer, and your activity levels. So how much you exercise. So those are ways in which we can prevent it. The biggest cause of lung cancer in the UK is smoking. Actually causes 8 out of 10 cases. So there'll be 2 out of 10 cases of people who don't smoke who do unfortunately get lung cancer, but the vast majority is caused by smoking. You can also get it from air pollution, so especially in heavily polluted areas like London, where there's lots of cars and factories and things like that. Air pollution can cause it, and exposure to radon gas, which is a naturally occurring gas that you can find in high levels in specific areas. Also, if you have a family history of lung cancer, that can also make you more susceptible. Now, lung cancer is the second most common cancer in the United Kingdom. And around 43,500 people are diagnosed in the UK each year. So quite a lot of people diagnosed every single year. So can you pause the video now? Make sure you've got those 3 things that I said that you needed from this, if you haven't already written it down. And then we're going to move on to the next type of cancer. So the next type of cancer is skin cancer, and it's actually one of the most common cancers in the world. There's lots of risk factors for skin cancer. Obviously, the amount of exposure you have to the sun, the use of sunbeds, the fairer your skin, the more susceptible you are. If you have red hair, because that tends to tie in. So it's my dog scratching her head there. She has a collar, a cone of shame on at the moment. Because quite often red hair will go hand in hand with fair skin. Your age, so the older you are, the more susceptible you are. Again, a family history of skin cancer. Other skin conditions, sunburn. So even if you've got darker skin, if you are getting sunburn, that increases your risk of skin cancer. And also the more moles and freckles you have, because that tends to tie in with how sensitive your skin is. What is it? There's 2 different types. You've got melanoma and non-melanoma skin cancer. And it depends on where that cancer is and how it moves about. So non-melanoma skin cancer is a group of cancers that develop very slowly, and it tends to be in the upper layers of the skin. Whereas melanoma is much more serious because it can spread to other organs in the body. Now, how can we prevent skin cancer? Using sun cream to begin with, but also obviously having a high factor sun cream, staying out of the sun during the really hot part of the days, and it's not the heat, it's just because the sun is more intense, so it tends to be between 12 and 3, not using sunbeds, and wearing hats and sunglasses when out. So you might want to pause the video now. And if you haven't already put down those 3 bits of information about skin cancer, can you do that, please? And then we'll move on to the third one. Okay, so the third type of cancer we're going to talk about is cervical cancer. And cervical cancer is a type of cancer that develops in a woman's cervix, hence the name. Okay, and the cervix is the ring of muscles between the vagina and the uterus. Almost all cases of cervical cancer are caused by human papilloma virus, or the HPV virus. And the HPV virus is very, very common, and it's passed through sexual contact between a couple. And if it infects women, it can lead to cervical cancer. There are more than 100 different types of HPV, so the virus we're talking about, over 100 different types of HPV, many of which don't really do anything, but some of them cause abnormal changes to the cells in the cervix. Now, apart from the HPV virus, which is the big hitter in terms of your risk factor of getting cervical cancer, another risk factor is smoking. So even though obviously I know it's not lung cancer, but actually smoking can trigger cancers elsewhere. Sexually transmitted infections, so other STDs such as chlamydia. Obesity or being overweight increases your risk of cervical cancer. Long-term use of oral contraceptives, like the pill and things like that, can increase your risk of cervical cancer. Again, family history and having multiple pregnancy, all of those can increase your risk of cervical cancer. It does not mean, and I'm sure Miss Corbett went over this, talking about correlation and causation, it does not, and risk factors, it does not mean that if one of those things applies to you, that you are going to get cervical cancer. It's just risk factors. Now, how can we reduce the amount of cervical cancer? Well, to treat the STIs and the HPV virus using a condom. The HPV vaccinations are now given out. My generation did not have the HPV vaccinations, but now it is one of the vaccinations that is done by school children. Routine cervical smear tests for women over the age of 25, and not smoking. So pause the video now and put down the 3 points of cervical cancer. Right, next one is looking at breast cancer. And there are several different types of breast cancer. Again, it's not just one cancer. It depends on where it's made. Not that's a bad word. Where it develops, how it acts, does create these different groups, and it can actually occur in both men and women. Now, obviously, it's more likely to affect women, but it can affect men and women. And you've got two different types. So you've got non-invasive breast cancers and invasive breast cancers. So you can read about those when we pause the video if you want to. How can we, well, first of all, do the risk factors. The risk factors are age. So that's why it tends to be as you get older, you'll go and have mammograms and things like that. Women are at greater risk than men. So even though it can affect both, women are at greater risk. Inherited genes, and through DNA sequencing, we can actually identify some of those genes. So if you are particularly at risk, if you have these certain genes, you can opt for certain surgeries to remove breast tissue and things like that. So Angelina Jolie, the actress, quite famously, she had a mastectomy. So she had the breast tissue removed because she had the genes that made her very high risk. Race and ethnicity also is a risk factor, with white women having the highest risk. How can we prevent it? So screening of people over 45. So over 45-year-olds will get letters that will ask them to go to the hospital or the doctors to have a mammogram. So there's a procedure that you can see in the picture, and they actually take an image of the inside of the breast to see if there's any irregularities there. Having regular exercise and a healthy diet will also reduce your risk, and breastfeeding can reduce your risk as well. Now, breast cancer is the most common type of cancer in the UK. So the one before that, when we were talking about skin cancer, it's one of the most common in the world, but breast cancer is the most common in the UK. Okay, one is testicular cancer. So this obviously affects men. It's a very common cancer for men, that and prostate cancer. Risks of it are men who are born with abnormal testicles, middle-aged men, so again an age concern, race, so it's more common in white men than other minority backgrounds, family history, tall men are more at risk of having it, smoking increases your risk of it, infertility increases your risk of it, and also STIs such as HIV will increase your risk of it. Now, what is testicular cancer? So it's the cancer of the testicles. It's not as common as the other ones in terms of skin cancer and breast cancer and things like that. It usually affects younger men. So unlike the others where it's quite often the older you are, the more at risk you are, this one actually tends to affect younger people more, between the ages of 15 and 49. Best ways of reducing your risk of it is having safe sex, so using condoms, not smoking, and also regularly getting checked at the GP. But actually, there was a big campaign, I suppose to me it wouldn't have been that many years ago, but it probably was a while ago now, making sure that you're checking yourself if you're a boy, just making sure that there isn't any abnormal growth or anything like that. You want to do that as early as possible so you know what the normal is, so that if you do come across anything abnormal, you'll be able to go and see the GP and see if it's anything to be worried about. Testicular cancer is very difficult to prevent. So even though we've got the suggestions on how you can reduce your risk of it, it's hard to prevent. So they don't have a massive impact. Right, sorry, I forgot to say pause on that. So if you want to go back a few seconds and pause the video, we're now going to talk about the last one, which is brain tumours. Okay. So brain tumours, similar to the other tumours, you've got this growth of cells, but it's happening in the brain. You can get malignant brain tumours or benign brain tumours, and they're actually graded. There is a wonderful grading system depending on their behaviour, so how fast they grow and how likely they're going to come back if they are removed. Risk factors of brain tumour is your age. So the older you are, tends to be the more risk you are. Medical radiation, so this is why there is limits on the amount of x-rays and things that you would have. Previous cancers, genetic history, overweight or obesity, smoking and alcohol as well. All of those are risk factors getting brain tumours. So doing things like not drinking or smoking will obviously reduce that risk. Having a healthy diet and exercising is important. And also, like with testicular cancer, if you're having any symptoms like persistent headaches, things like that, then you go and see the GP as soon as possible so they can see whether it is something to be concerned about. Okay. So we're going to move on now, and we're going to be looking at some of the big risk factors involved in cancers and your susceptibility to cancers. So before we get going, can you pause the video and can you put down as many different risk factors that you can think of? We have mentioned quite a few, but any other risk factors that you can think of that will increase your risk of getting cancer. So pause the video now and do that. Okay, so you don't need to write this down, but actually here is a pie chart just giving you an idea of the impact of certain risk factors. So you can see that actually smoking and your diet and obesity have got a similar rating. So they're both big risk factors to cancer. Then we've got the rest of them tend to be quite small compared to obesity and smoking. So you've got things like socioeconomic status. So that's talking about how much money people have. We've got pollution, which we've mentioned, UV radiation, so that's like sunbeds and things like that, or not wearing sun cream. Certain drugs and medical procedures can increase your risk. We've got salt and food additives to our food that can cause it. We've got viruses, we've got family history, an inactive lifestyle, things like that. Quite a few risk factors, but the big hitters are smoking, your diet, which often, if it's a poor diet, will lead to obesity. Okay, so scientists don't fully understand what triggers formation of cancer. So some people can be incredibly healthy, not drink, not smoke, have active lifestyle, exercise regularly, have no family history, but can still get cancers. But there are kind of three big outside risk factors. So risk factors that you don't really have control of, so it's not to do with your lifestyle and things like that. These are things that can cause it that you're unaware of. So genetic risk. So certain cancers, breast cancer, ovarian cancer, have a big genetic risk. So if you have members of the family that have had breast cancer, it doesn't mean that you are going to get breast cancer, but it is something to be aware of to make sure that you're regularly checking that you have got a higher risk. Mutations in the DNA, which are often caused by things like asbestos. So that used to be this wonder material that people use for so many things in buildings and things like that, but actually realize that can cause lung cancers and things like that. It's carcinogenic. Tobacco, things like that from smoking also trigger tumours, and we call those things carcinogens. So they're the chemicals, the molecules that cause cancer or increase your risk of cancer. And the other one is ionizing radiation, so ultraviolet light, X-rays, gamma rays, and things like that. So if we could pop those three triggers for the formation of cancer and what they're about, that would be great. So pause the video now. Okay. So we're going to move on to the last bit of the lesson, and this bit is going to be something that you're going to be doing independently. And it's looking more at the treatment of cancers. And this is particularly important if you are aiming for grades 5 and above, because quite a lot of the time it will ask you about the risks and the benefits of different types of treatments. So I wanted to find out about the different methods for treating cancer. You may be familiar with them. Most of the time cancers are treated by two different methods. One is chemotherapy and one is radiotherapy. So what I would like you to do is find out about these two different methods for treating cancer. And for each one, I'd like you to give a brief description of how it works, what's involved, what does it use, that kind of thing, and then a description of the benefits and the risks of them. So I can see that I've made a mistake on this PowerPoint. Excuse the bell. Because that last sentence should be a description of the benefits and risks of radiotherapy. So can you find out about the two methods of treating cancer and the risks and benefits for both of them? And it should take you about 20 minutes, and pop it into your notes. Okay, so hopefully we've found out about chemotherapy and radiotherapy and made some notes about it. Because now I'd like you to, without looking back at those notes, have a go at describe and explain the different treatments that are used to treat cancer. So I want you to, from memory, kind of summarize all that you've just done and describe and explain the two different treatments. And this will probably be worth about 4 marks in an exam. So if you pause the video now, without looking back at your notes, have a go answering that question. Okay, so hopefully you've had a stab at that, and hopefully we have got something along the lines of what I'm about to talk about. So grab a different colour pen and mark accordingly. So radiotherapy, this is when the cancer cells are destroyed by radiation. So they will target radiation specifically to those cells. It stops that division, the mitosis in those cells. But the risk is it can also damage healthy cells. So if you're having radiotherapy in areas like the brain to remove brain tumours, things like that, it needs to be very, very accurate to make sure that it's not damaging any brain tissue. The other method for treatment is chemotherapy, and this is where chemicals are used to stop the cells dividing and actually cause them to self-destruct, so destroy themselves. It's hard to target specifically the cancer cells, which is a risk because then obviously it has an effect on your other cells and can make you quite ill. So hopefully we picked up some of those points. Hopefully we found that anyway in our research task that we did, because that is the end of this lesson. Quite a deep lesson for the last 8 weeks, so I do apologise for that. So hopefully we're able to talk about or define what a tumour is, and give some risk factors of getting cancers, and also know some of the benefits and risks of chemotherapy. For grades 5 to 6, knowing the difference between benign and malignant tumours, describing why pathogens and ionizing radiation increase your risk. That's talking about, that links to the physics. So it's talking about the mutation of the DNA. For 7 to 8, we need to explain how these tumours are life-threatening. So that's talking about pressing up against organs, arteries, nerves, things like that. And how a lack of control of the cell cycle causes tumours to form in the first place, and knowing the risks and benefits of both chemotherapy and radiotherapy. So I hope you have a lovely weekend. Very well done for accessing this lesson. We've got a few more bits left of health and disease for next week, and then we'll be moving on to the next chapter. Thank you very much, well done, and goodbye.